Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in cancer prevention and treatment and also public health. In this video, we are going to look at obesity and the cancer risk, and we'll unveil some of the information that is very critical for you knowing the relationship between cancer and obesity. What if the extra weight that you are carrying is writing a cancer story in your body slowly? Most people worry diabetes or heart disease, but few know that obesity is a big risk for cancer. Today, the truth can save your life or someone you love. So obesity is now the second leading cause of cancer, which is preventable. And this is has been shown by worldwide statistics. Over 13 types of cancer are linked to excess body fat. But many people don't even know that this is a risk. So it's not just about the size. It is about the fat and what it does to your body. So fat is not just fat. It is active tissue. For a long time we thought that adipose tissue is just silent fat lying in your body. But it has been shown that visceral fat, especially the fat in your belly, produces estrogen. It produces insulin-like growth factor. It produces inflammatory cytokines, which are involved in cancer genesis. And these fuel abnormal cell growth and even cell mutations, which are the backbone of most of the cancers. So your body is in a state of chronic inflammation if you have excess fat, and the cancer loves this. So which are the cancers that are most affected? One, obesity is strongly associated with breast cancer, especially for postmenopausal women, colon and rectal cancer, both men and women, uterine cancer in ladies. We have esophageal cancer. This is especially so because obesity is one of the factors that is associated with gastroesophageal reflux disease. And this causes inflammation of the lower esophagus, and this can lead to change of cells, and these cells can mutate to cancerous types. Then pancreatic cancer, due to the inflammatory process leading to depletion of the cells of the pancreas and the abnormal mutations in the pancreatic cell. Kidney cancer, liver cancer, ovarian cancer, gallbladder cancer, thyroid cancer, multiple myeloma, meningioma, and even stomach cancer. These are some of the cancers associated with being overweight or having obesity. So there are some individuals who have been diagnosed with some of these cancers, and the real risk they had is just their weight. So there is hope that if you lose even 5 to 10% of your body weight, you can reduce the estrogen and the insulin levels that are being secreted in your body. You lower the inflammatory cytokines, which are the triggering inflammatory triggers for cancer, and also you boost your immune surveillance. So less weight means less risk for cancer. So what should you do? It is important that you know your body mass index. What is body mass index? This is your weight in kilograms divided by your height squared. The figure you get, it will give you what is your BMI. If your BMI is between 18 and 25, that is normal. If it is between 25.1 to 29.9, then you are overweight. 30 and above, then you have obesity. It is also important to know the fat distribution in your body, and this you can easily tell by the waist circumference. Then it is important that you eat whole grains and eat an inflammatory foods. The whole grains, they are rich in nutrients. So the hope is real. Every kilo that you lose counts. If you lose 5 to 10% of your body weight, this can help you reduce the estrogen and the insulin levels in your body. It will also help you lower the inflammation that is happening in your body. We have talked about the inflammatory cytokines. Losing your weight and reducing the belly fat reduces the cells producing these inflammatory cytokines, and this means less risk to cancer. Then it also helps improve the immune system, surveillance system, and this will be able to cope up with these abnormal cells that might be mutating in your body, and your immune system can be able to comfortably remove them. So less weight means less risk of cancer. To take action, if you want to be assisted to lose weight, subscribe to our Health Insights 360 program, which will help you lose weight naturally and be able to reverse diabetes, reverse hypertension with less use of drugs, and also reduce your cancer risk and help you overcome obesity with all these associated risks. So action plan. This is health. It is not just hype. So it is important that you know your BMI. When you talk about the body mass index, what are we talking about? It is your weight divided by your height in meters squared, the figure you get. If it is between 18 to 25, that is within the normal range. If it is between 25.9 up to 30, then you are overweight. And if it is beyond 30, then you are you have obesity. And obesity can be mild, moderate, and severe. And all these can be overcome with the right lifestyle changes. Then it is important that you know what is the fat distribution in your body. And this is usually measured either using your skin thickness, using a calipers, or you can also use the waist circumference. For men, your waist circumference should be less than 102 centimeters, and for ladies, it should be less than 88 centimeters. You can just use the normal tape measure to take your waist circumference around the belly button. Then foods. It is important that you take whole foods. These are rich in fiber, and these fiber-rich food, they are also rich in nutrients, and this helps to reduce inflammation and also gives you the necessary nutrients to build your immunity, things like selenium. So eat whole and processed food. These foods are usually the whole grains. They are high in fiber, and also they are nutrients dense, and they help you to fight cancer. Then it is also good to eat anti-inflammatory foods which help your immune system to work better. Foods like turmeric, ginger, they really help your body to fight disease. And of course, most of the green leafy vegetables and many of the nuts and the fruits. Then it is important that you keep moving. They say that movement creates a healthy mind and also boost your feel good hormones like endorphins. So try as much as possible on a daily basis to move at least 30 minutes most of the days of the week. Then another thing that we really do not consider as life preserving is sleep. And having adequate sleep is very good for your health and fighting cancer. So ensure that every night you are getting 7 to 8 hours of uninterrupted sleep if you want to keep away from the doctor. Then avoid sugars, the ones that you use for tea and the added sugars, and also the sugary drinks and the processed snacks. These ones have a high input in the inflammatory process of the body, and they increase your risk of getting cancer and also gaining excess weight. So start small, keep going, and every step that you make always counts. So for those survivors of cancer, remember that for cancer survivors, obesity increases the recurrence risk. So it is important that you make weight management as a priority as part of your long-term survival. This is not just prevention, but it is also protection. You prevent yourself having a recurrence of cancer, and it keeps you cancer-free longer. So you are not alone in this journey of fighting your weight and also maintaining good body weight. Join our community. Also share your journey with others. You can leave your comments below this video and tell us and share with us what are some of the things that you have been doing to maintain your weight and to protect yourself from being overweight. And also join our YouTube channel for more healthy tips. And if you have challenges, you are trying to lose weight and you do not know what to do, get a personalized coaching through our Health Insight 360 program, where we will give you personalized coaching which will help you lose your weight and be able to overcome diabetes, be able to overcome cancer, be able to overcome your risk of worsening osteoarthritis. So your body is a temple. It is not just a storage unit. So don't wait for symptoms. Start today because cancer doesn't wait, and neither you should you. Today is the day for action, and let's all get started. Thank you for watching.